Hello, I'm Physician Associate Camille. How can I help you today, Damien?
Hi, my feet don't feel right. I'm a rugby player and it's stopping me from practicing because my feet feel like they're burning and I keep having pins and needles.
Right, do you feel different anywhere else?
No, just on my feet.
Right. When did you start to feel the pain?
About 10 days ago. I thought I was just tired, but it didn't stop.
Is the burning sensation and the pins and needles constant, or does it come and go?
I always feel it.
Right, and do certain activities make it worse or better?
Walking makes it worse, and when my feet touch anything, it hurts.
And how painful is it on a scale of 1 to 10, 10 being unbearable?
I would say it's 9.
Right, and is that only when you're walking?
Yeah, just when I walk.
And how is it when you're not walking?
About 7.
Right. Okay, a 7. Did you have any injuries around your lower limbs or your lower back?
No, I've been quite fortunate.
And did you have any fever lately?
No.
Okay, good. I'm looking at your medical history right now, and it says that you've not seen the doctor for a while.
Yeah, I've been healthy until I felt my feet go weird.
That's great. And do you smoke?
No.
How about alcohol? How much do you drink?
Well, the team always hangs out after practice all the time. We end up drinking at least 3 times a week.
Okay, and how much do you drink during those times?
Maybe 6 pints until I start feeling drunk. I don't even know what happens most of the time.
At what age did you start drinking?
Um, about 15, but I didn't start getting properly wasted until I was 18.
Right, and how's your diet like?
I'm always feeling hungry and weak, though. I eat a lot of snacks in between my meals. I also love pudding, so I have one every meal.
After every meal. Right. And does your family have any diseases?
Oh yeah, my grandparents and parents have diabetes.
Okay, and your grandparents with diabetes, is that from your mother's side or father's side?
Uh, both.
Is that the only disease they have?
Yeah.
Right.
My grandma from my father's side, she died from a heart attack.
Okay. Thanks for answering my questions. Is that okay? Is it okay if I check on your feet?
Yeah,
Great. Can you please roll your trousers up to your knee and take your socks off?
sure.
Right. Right now I'm just checking on for any wounds. Seems like there's none. That's really good. Can you wiggle your toes for me? Perfect. Now I'm just going to poke your feet in a few places to check how sensitive it is, okay? I can try it on your forearm so you know what it's going to feel like. How was that? Not bad, right? Yeah. Good.
Just a small poke.
Yes, that's good. I'm going to do the same thing on your feet now. Can you close your eyes, please, and say yes whenever you feel like I'm touching your feet? All done. You can put your socks back on now. Right, Damien. You have felt it 4 times out of 10. So I'm going to send you in for a nerve consultation, nerve conduction test, and electromyography to confirm the diagnosis. Meanwhile, I'll ask that you limit your drinking, hold back on your puddings, and keep up with your exercise if you can. Is that okay?
Yeah, sounds good.
So you said that a few of your family members have diabetes. Sometimes diabetic patients present with similar symptoms to yours, so I'm just going to make sure that your blood sugar levels is okay. I'm going to check your blood sugar levels now, if that's alright. It's going to be a small prick on your finger.
Sure.
Your sugar level is higher than the reference range, so I'm just going to send you to the hospital today for blood sugar assessment. You're going to be there until you get the result, and if the result shows that you have diabetes, then the nurse will explain to you how you can manage your blood sugar levels. Hi Damon, how are you feeling today?
I went to the hospital that day, like you said, and said I have type 1 diabetes. I also didn't go to any of my rugby practice this week because my legs keep hurting and getting pins and needles.
And did anyone in the hospital tell you how to manage your type 1 diabetes?
Yeah, they gave me insulin and blood sugar test kits, and they explained to me well. They also gave me a leaflet about the disease. So I've been trying my best to keep my blood sugar steady.
Okay, that's brilliant. So first of all, you shouldn't worry because there are pro athletes who also have diabetes, like Chris Fennell. Do you know him?
Yeah.
Okay, now those symptoms that you feel now is because you have a condition called diabetic peripheral neuropathy. The sugar in your blood damaged some of the small vessels in your feet that supply the nerves. This is why you feel symptoms like pins and needles and burning sensation on your feet. It's not common in young people, but we are all different. And then to treat this, we have to control your blood sugar levels. Now you said you eat pudding every day.
Yeah.
Right, then maybe we can, reduce that and, try to use low sugar alternatives instead. And the main thing to do is to cut down on your alcohol so your condition does not escalate as well. And then you have to maintain your healthy weight and still do your exercises if you can. I'll get the doctor to prescribe you some medication so you won't feel the pain.
Yeah, I start reducing my pudding after meals, but I don't feel comfortable when I do my regular exercise.
Okay, I can refer you to the physiotherapist to help with that. Is it something you would like to do?
Yes, please.
Okay, and if the pain gets worse, set another appointment so the doctor can prescribe you medications and he could have a look at it as well. We would also like to set up appointments regularly to monitor your diabetes. Do you have any questions?
Should I be worried? Is there any cure for my condition?
Alright, so right now we do not have a cure for diabetic peripheral neuropathy, but we have, by keeping your blood sugar steady, it should halt the nerve damage and prevent worse symptoms. So by following the physiotherapist and having regular checkups, we can strengthen your foot muscles and monitor your diabetes closely. Just make sure that you wear protective shoes and that you clean your feet well. Always check if there are any wounds because you may not feel it, but it could be there, and that could lead to foot ulcers. It could be really bad, especially if you have diabetes.
Can I go back to playing rugby?
Yes, we can manage your symptoms by using the medications so you won't feel the pain and you'd be more comfortable on the field. And of course, managing your blood levels and reducing your alcohol intake would also help to stop the disease from getting worse. Does that help to ease your concern?
Yeah, thanks.
All right. That's it now. Take care. Bye.